Should I take medication to get over OCD? If this kind of video is interesting for you, please continue watching. So basically, my view on it is that you need to truly ask yourself, is medication necessary for your recovery? Meaning, can you go through your recovery with or without, can you go through recovery without medication? Because you gotta know that if you're feeling bad now, in the beginning, like that first week of recovery, you're gonna get just a lot of thoughts, and you need to be able to push through and do the right thing and not seek reassurance and not avoid and just keep going. If you think you can do that without medication, then you don't need medication. Again, I'm not a doctor, so this is my opinion. But if you feel like just the anxiety is overwhelming and you won't be able to do the recovery program without the use of medication, then, honestly, it's not going to really make long-term harm for you to take medication for a few months. The most important thing with it, though, is that you need to make sure you're taking medication as an addition to your recovery program, whatever that program is. And both you and your therapist need to be very clear on that fact. You're not, I hate when doctors say, people take medication for life for other things, so it's okay if you take it for OCD. No, it's not okay if you take it for OCD because you're actually not recovering. It's like you are just taking pain pills, basically, So you're not dealing with the problem. You're not solving the problem why you have the pain. You're just solving a symptom of anxiety. And anxiety is just a symptom of OCD. So your brain is still not functioning correctly. And honestly, OCD really does have 100% recovery. When you recover, your brain recovers 100%. So it's not something that, you're stuck with, that, you are in a bad situation in your life where you have to address it and have to deal with it. But if a doctor tells you there's no way you can recover from OCD, get a better doctor. I'm serious. 100%. Because it is possible to overcome. And you don't have to take medication for life. But, if you take medication, it takes the edge off, it makes your recovery go smoothly, it makes you seek less reassurance, then do it. After all, sooner or later, you're going to get over OCD, and the medication is just going to be unnecessary, and it's just going to fall away on its own. So, as long as you do what I suggest in my videos, what other people suggest, with the, not seeking reassurance, not avoiding, living your life as if you don't have OCD, you will recover. It's hard work, but you will recover. And if you do it with medication for a few months, then you do it with medication for a few months. It's really not as big of a deal as all that. It only becomes a big deal when it becomes a lifelong crutch, and that's just something you shouldn't do. Anyways, that was my view on medication. I have a previous video, and this was just kind of updated from that because, the previous video was made about, 5-6 years ago. So obviously I've talked to so many people because I talk to people all the time, helping them recover from OCD, and with more experience, your view slightly changes. So if you like this video, please give it a thumbs up. If you have questions that are private, email me at info@youhaveocd.com. If you have questions that are, public, please leave it as a comment below. And thank you for watching. Have a good one. Bye.